The Enluxtra, or the self-adaptive dressing, makes patients happy, and it makes nurses happy. The patients, it's basically, we've all tried to float a dressing off, a dressing that dries out and sticks to the wound bed. Tremendously painful, and you don't see that with Enluxtra. As far as nursing satisfaction, again, simplifying the number of dressings types that they have to learn and manage the patient, how often that they have to intervene with the patient, the ability to cut the product to fit certain wounds, all that's easy. And so Enluxtra has superior performance in all those areas. As far as patients, it's a very soft dressing. It's very malleable. It moves with them. Doesn't stick to their wound. Doesn't pull on the wound. The fact that it can donate moisture keeps wounds from getting dry and getting painful. So it does the moist interactive wound care extremely well for the patient, and the patient satisfaction with less interventions such as dressing changes, and then all the different problems that we've all encountered with dressings that can get dry, makes it very satisfying to the patient. We've used Enluxtra probably about a year now. I like the quality of the material. It doesn't break down easily. It's a very sturdy backing, but the part that does the heavy lifting is the gel type surface that sets on the patient's wound. And I'm going to say this better.
No worries.
Okay, so the moist component to the wound that impacts the wound does self-adjust. It does donate moisture, and it also will absorb quite a bit of moisture. And that's real important in the type of wound care that we do. We do biofilm-based wound care where we're leaving dressings on for a week at a time. And during that time, we have we've identified the bacteria on the surface of the wound. We've formulated a antibiotic and anti-biofilm gel that is in a drug delivery system that can manage the wound for up to a week at a time. Our problem was we didn't have dressings that could work with that gel. So what we found with Enluxtra was we could change the dressing once a week. It works very well under a cast or under a Pro4 or something like that. We could change the dressing twice a week so we could have some of our nurses or other wound care clinicians see the wound more frequently. So the dressing gives us a lot of different options for managing the different types of wounds that we encounter, and that really works well. So for the entire clinic, for the flow of the clinic, to have it down to this, I don't want to say that either. So that really works well for the flow of the clinic, that we can have a less number of different types of dressings that we have to turn to. So now I'm going to start answering your questions.
Sure. Could you please address efficiency cost?
Oh, okay. Well, we feel like that Enluxtra is extremely efficient for us in terms of cost benefit. It might be a little pricier than some of our dressings, but again, it works well with our other treatment options for biofilm-based wound care. It works well with our gels, and so we can do less dressing changes. We're changing it twice a week or once a week, which really helps out the home health agencies, helps out the hospital personnel by decreasing those dressing changes. And I don't worry about it because of that self-adaptive mechanism. A lot of times we'll put appropriate antibiotic gels on the wound, and we'll go from a fairly exudated wound to a drier wound in the course of 3 to 4 days. But during that time, the dressing itself can absorb any excess moisture up front, and then as we start suppressing the wound biofilm, the inflammation goes down, the exudate goes down, then it can actually donate moisture to our gel to allow it to work better, or donate moisture to the wound if we need to. What we see on the edges is a lot less maceration. Because of its ability to control the wound exudate, we see a lot less maceration, a lot less scalding of the wound, and that's improved patient comfort, but it's also, we don't get the secondary problems that often comes with the overhydration of the skin. Dressings are much more important in wound care than what we realize. So in biofilm-based wound care, which is what we do, what we're really focused on is the surface of the wound, and that's because chronic wounds are chronic infections. There's surface bacteria attached to the wound, and that bacteria feeds itself by producing inflammation, causing plasma to come up, to percolate through the wound slough, the wound biofilm, and that's how it feeds itself. If we can take that nutrient source away from the biofilm, we think that diminishes it, suppresses it, so that our other treatments work well. Well, that's where the dressing comes in. A dressing that can absorb moisture fairly fast, can keep that moisture from wringing out or coming back into the wound. It takes that nutrient source away from the wound biofilm. Now, the other thing about that we find with the self-adaptive dressing is when we put our treating agents on the surface of the wound, very often it's an exudate, even an inflamed wound. And then over the next 2 to 3 days, as those antibiotics, as those other treating agents are able to suppress the biofilm, that exudate's not coming out anymore. Well, our gel tends to get less hydrated. Our wound tends to get drier, and if you have a self-adaptive dressing, then that moisture can be donated back into the gel, can be donated back into the wound, and it solves that problem. That allows us to go longer periods of time with a single dressing, and again, that decreases the workload for the nurses. We don't have to worry about what's happening under the wound as much because it does adapt. So at the end of all of that, when we pull that off at 3 to 4 days, we have a wound that again isn't macerated. The dressing has accommodated the needs of the wound as they've evolved over that 3 to 4 days.
That's great. I have simplification of protocol as the next question.
Okay.
You've spoken a little bit about that. Can we single it out and just, would you be repeating yourself?
Oh yeah, but that's fine.
Oh.
We'll do it different ways, and then you guys,
Could we, please?
Oh yeah.
Okay, thank you.
Yeah.
So, simplification of protocol.
I've cut video before, and you're sitting there and you're saying,
Yep.
if he just tilted his head, or if
Exactly.
the light wasn't,
The more we can get.
yeah, you get you better clips.
Thank you.
Okay. The other thing about Enluxtra, or the self-adaptive dressing, is that it simplifies our protocol, our workflow within our clinic. We have to stock less different types of dressings, and then we can choose a dressing that can meet a lot of different wound care needs. A highly exudative wound, it can accommodate that. As that wound changes from highly exudative to less exudative with treatment, it will adapt to that environment. And dry wounds, it can actually donate moisture to that. That simplifies what you have to turn to in managing the chronic wounds. That simplifies the workflow for our nurses and people that are applying the dressings. And it also decreases the amount of dressing changes we need in between, so our workload for home health or for the patient or their family. So it simplifies the protocol dramatically in terms of number of dressing changes and just number of products that you have to turn to for the different types of wounds.